Dr. Craig Schwimmer, Medical Director of the Snoring Center, is one of a dozen people performing the FinESS procedure to help relieve chronic sinus infections. So, welcome.
Welcome back.
So, first things first, feel free to tell everyone how miserable you've been with all these recurring infections in your sinuses.
Oh gosh, it's really been bad. Really my whole life, and especially the last year, I've had just really a lot of chronic infections that really made me really sluggish and tired and just really tired of being sick all the time, basically.
Well, and that's why you're here. And we have a cool little animation, if you can walk us through what this procedure is, because it's so very cool. I love this procedure.
So what we're looking at now is we're looking into the maxillary sinus or the cheek sinus, and there's this little balloon snaking up towards what's called the osteomeatal complex or the infundibulum. That's the drainage pathway for the sinus, and if that isn't open, the sinus can't drain and it gets infected. And we see a balloon being inserted and inflated to make that passageway bigger. You can think of it sort of like an angioplasty for the sinus. And it's brilliant. This is a 10-minute...
Greg, this is not your grandmother's sinus surgery.
No.
This is cool stuff. Now, why is Linda such a perfect candidate?
She's perfect because she's been sick a lot for long. She's had 10 sinus infections. She's been treated with appropriate antibiotics and steroids, and she gets better and she gets worse again. She gets better, she gets worse again, and she doesn't want to have to go to the operating room and have formal surgery.
And what you explained to me, it's best for the maxillary sinuses, your anterior sinuses.
Exactly. So this treatment is best for the anterior sinuses, for the maxillary sinus, maybe a little anterior ethmoid disease or behind
I can't believe we're doing it right here.
Yeah, it's crazy.
And to explain, I want everyone to understand, the audience and at home, the reason that Dr. Schwimmer's holding that there is he's actually created an opening in the bone to get into the sinuses, and that's a little tunnel that you're going to use to do the procedure.
Exactly, and this is really a melding of something very old and something very new. Back in the day, we used to do something called a Caldwell-Luck procedure, and you would make a big incision under the cheek and get into the cheek sinus, and that works really well, but it's very, very painful, and people would swell, and it's a miserable thing to go through.
Major operation.
Yeah, big deal. Well, this is a twist on that, where we incorporate angioplasty technology and a tiny little hole through this sheath that we poke in with a little awl under local anesthetic. It takes a few minutes, and it allows us to access directly the area of interest and resolve the problem.
So, Linda, are you ready?
I'm so ready.
Let's do this.
You look like you've been ready.
So what we're going to do is we're going to introduce this camera into this sheath, and now we're in the maxillary sinus, and right here at 1 o'clock is the drainage port. That's the hole that we're looking to enlarge, because it's too small, so it's not working effectively. So what we're going to do is we're going to take a little balloon.
And you actually can see some sinus disease in there, can't you?
Absolutely. The tissue is inflamed, and you can actually see earlier with the other camera, we saw some pus and some mucus in there.
So sinus disease, it's all about the opening, natural opening not being open. Exactly. What you're doing is you're enlarging it, making sure it stays open.
That's exactly right, because the sinuses, like any other cavity in the body, that are meant to drain, if they don't drain, they get infected. And so all we're going to do here is enlarge the natural drainage port. And so now we've put this balloon into the hole. Dan, if you would inflate the balloon. Linda, you're going to feel some pressure. You'll probably hear a little cracking.
So are you actually breaking that bone there?
We're breaking that bone and just pushing it aside so that that drainage pathway is larger and able to perform the function it's supposed to perform. We're down. And the balloon is down, and we're done.
That's it.
Instead of sinus surgery.
How is she going to do after this procedure?
We're gonna send her home with some antibiotics. We're also going to send her home with a bag of peas, frozen peas or frozen corn, to put on her cheek so that it doesn't swell. She'll be back to normal activities tomorrow.
Wow. And Linda, can you give us a thumbs up? And the whole idea is now that
was awesome.
mucus, any infection will drain out. It won't get
Open those sinuses up.
To be fair, you know, this isn't for everybody with sinus disease, but for appropriate patients, it's brilliant because it takes 15 minutes. You do it in the office. It's not a big deal. And you go right back to your activities.
Well, guys, thank you. Linda, thank you.
Thank you. Frank, good job. Thank you. Awesome.
We'll have more information about this breakthrough procedure on our website, since just a few practitioners are doing this as of yet.